Hi, I'm Arun George, and you're listening to Three Things, the Indian Express news show. Since the nationwide lockdown to slow the spread of COVID-19 was announced in March, police forces and paramilitary personnel have been tasked with enforcing it. But with the enforcement have come allegations and plenty of videos that have accused police personnel of high-handedness and extreme measures. Despite these allegations, police forces have been at the front line. They've enforced containment zones, provided protection for healthcare workers, transported people in emergencies, and even aided in the transport of migrant workers. But this has also resulted in many of them contracting the virus and putting them at risk. According to data from think tank Indian Police Foundation, there have been over 4,000 personnel across police and paramilitary forces who have tested positive for the virus. 38 of those who contracted the virus have died. On Wednesday, the Indian Express reported an incident where upset police personnel in West Bengal protested after a colleague died due to the virus. In this episode, we'll be speaking with Deeptiman Tiwary, who covers the Ministry of Home Affairs for the Indian Express, about the spread of the virus in paramilitary forces and what the top brass are banking on to get through. We're also speaking with Prakash Singh, a retired Director General of Police and Chairman of the Indian Police Foundation, about the lessons for police forces from their handling of the pandemic. But first, we speak to the Indian Express's Mohammed Thaver in Mumbai. The city that has the highest number of COVID-19 cases in India has also seen the most deaths among police personnel due to the virus. We started by asking him how the outbreak has affected the city's police. Mohammed, Mumbai is an epicenter for the spread of the virus, and the Mumbai police has been at the forefront of enforcing a lockdown and even caring for people in some senses. But they've also been badly hit by the virus. Could you tell us about the impact?
See, Mumbai police is roughly around 50,000 strong force. And so far, there have been 12 deaths in Mumbai police, and over 1,000 people have been affected by the virus. Now, the biggest challenge for the force, because the job itself entails that they go on the field, and since they have to keep people off the roads, there is a certain interaction, certain level of social interaction that they cannot avoid. Also, keeping people indoors, etc. So in that way, with the high number of cases, especially the cases have been in some police stations, like for example, the JJ Marg police station, which had 26 cases. So in that context, cops have also been scared about, what happens, what if they are infected, what kind of help will their family get, what if they pass on the illness to them. So these have been a few concerns that especially the lower rung officers who, for example, don't stay in Mumbai, who cannot afford houses here and they stay in Kalyan, Thane and come from far away. So these have been issues that, they have been a bit scared about. They have been generally also, like even when we spoke to the police commissioner, he said that apart from the obvious things that they have to do to kind of ensure that these guys do not contract the virus, it's also been a psychological kind of an issue wherein these cops are not feeling that motivated, in the sense they're all scared. And especially people succumbing to the illness, is kind of scaring them, and they have their families to look after. So in that sense, what has been happening, especially over the past few weeks when the numbers started rising, was that the commissioner and the home minister visited police stations that were badly impacted and kind of gave a speech kind of a thing just to, boost their morale.
Mohammed explains that most of those who died due to the virus were those on the field and weren't in the high-risk category.
So far, there have been 12 deaths, and a majority of them, they were actually doing more field jobs, in the sense, for example, like there was a cop in Shivaji Nagar who passed away. Now, Shivaji Nagar, Govandi, again, is an area that has had a lot of cases of corona being reported. And he specifically used to travel in the patrol van that would patrol the entire area. So generally speaking, of these 12 people who have passed away, the commonalities have been that they have, one, been doing field jobs. So, for example, you have at least 3 men from the traffic department who are on the roads. And also, these were also cops who were posted in areas that were seeing a lot of these cases. Like I explained, Shivaji Nagar area, this happened, and JJ Marg area, because later on, even that area, it turned out, had reported a lot of cases of coronavirus. So while they did not have any specific case of comorbidities, because the cops had said that if you all have comorbidities, you all can inform us and we will take you off duty, especially in these areas that have seen a lot of cases. But these were specifically cops who were posted in areas that had seen a huge number of cases.
He also says that the Mumbai police has come up with a variety of schemes to try and put officials' minds at ease.
One of the first things that the Mumbai police did is when they realized that, okay, obviously when it comes to comorbidities, it is much more riskier. So firstly, they kind of told cops who were about 55 years of age, nearing their retirement kind of thing, they told them to stay at home. And also cops above 52 years of age who had some kind of comorbidity. Like they just had to show a certificate or whatever, and they could then be told that, okay, you don't need to report to work. And apart from that, also another problem that was actually initially happening was initially the cops were supplying PPEs, but then they got a kind of feedback from the lower rung that, it's not convenient to, because it's one, it's very hot. And secondly, as far as policing is concerned, wherein it's a very dynamic job, wherein you're running from one place to the other, asking people to go out. So from the lower brass, they got this impression that, okay, this PPE business is not working for policing. So that's the reason even on the road, you'll rarely see, you'll see cops wearing a mask and having gloves, but it's not very practical for them to have, to wear the PPE on all the time. Then what these guys started doing is these guys started also having these mobile vans carrying sanitizers. And then a few weeks back, there was an announcement made that in case any cop, succumbs to the illness, like if he contracts corona, 10,000 rupees is directly transferred to his bank account so that the family doesn't have to face any problems because of the money. And if unfortunately he passes away, then these guys get 10 lakh from the Mumbai Police Fund. In addition to that, there is a 50 lakh award that they get from the state government.
And there were some pretty unique initiatives as well.
If they had a cop who tested positive for COVID and then recovered, and then later on, if there are any other cops who are also testing positive, they make the cop who has recovered called up the cop who's just tested positive and tell him that, it's okay, and I went through this, and this is what helped me, this did not help me, and just to generally motivate the person, saying that, I'm on the other side in a certain sense now, and it's all right. After 14 days, you'll also feel fine. Another thing is that vanity vans that Bollywood actors etc. use. So they have stationed these vanity vans on highways where cops are doing bandobast. So especially women police officers can then use the washroom in the vanity van and rest a bit over there. And one last thing that these guys have kind of started doing is that earlier you had 8-hour shifts where you came and then you went back home. Then the next day you came again for 8 hours. They have now made it into a 12-hour shift, wherein you come for 12 hours and then for 24 hours you get rest, you can be at home. So in that sense, it reduces the amount of traveling, it reduces the amount of infection, and it also kind of gives you that much more rest.
But among the measures that proved to be controversial was a decision to distribute the drug hydroxychloroquine among a group of officials. The World Health Organization has said it stopped trials to check whether the drug can work as a form of treatment against COVID-19. However, India has defended its decision to keep using it among frontline workers to prevent them from getting infected. Mohammed explains what happened in Mumbai.
As per the initial plan, 10,000 cops were supposed to get it, but later it came to light that all of them were not very comfortable, so around 4,000 people took it. But like the Express itself had reported, that this was actually not done in consultation with the cops, because as far as HCQ is concerned, there are a few things that have to be checked, like you should not be suffering from a heart problem. Generally, it is advised that, you go to a doctor, get a clearance from the doctor, and then take this, which actually was not done when it came to the Mumbai police, wherein they just popped the pills. And a lot of constables, like my colleague Sagar had done a story on this, wherein he spoke to around 15 cops who had taken HCQ. So they said that, no, we trust if our seniors are kind of giving it to us, and if they are saying, then we trust that it will help us ensure that our immunity levels are high. And psychologically also they felt that, okay, if we are taking this tablet, we feel more confident in, reporting to our jobs, and we feel that this will keep us away from the virus.
Mohammed says that the police has attempted to ensure that officials who may be at high risk were deployed in police stations instead of on the ground. However, he points out that there are challenges unique to Mumbai that makes policing its streets and staying safe from the virus difficult.
One of the biggest problems for Mumbai cops is the density of the population. So if you are a cop in Shivaji Nagar police station, and you're going to Govandi and you're trying to tell people to go back to their houses and not crowd on the roads, you'd suddenly be surrounded by a lot of people. Like if there's a team of 6 cops and there are 25 people or there are 30 people, and if they're not listening. So what they say is that in spite of their best efforts, they will come in physical contact with people. And, so that coupled with the fact that these areas are high risk has been the reason why a lot of these cops kind of eventually contracted the virus and then passed away.
So, Mohammed, you've been talking a lot to the police personnel during this pandemic. What's the biggest issue they've been facing?
See, I think a lot of cops are, like I said, like at the top brass, when you hear them, they say that we have provided PPE, etc. So the lower on cops, firstly, what they're saying is that, one, PPE is out of the question because we cannot wear that while doing policing. It's not practical in this weather. And a lot of them are also concerned about their own families as well. So, for example, like there was a constable whom I was talking to. His wife also works in the force. So their son now, they have kind of asked his mother-in-law to keep the son with her because they come back home every day and they do not want to put their son at risk. So a lot of cops, what they're also doing is they're staying back at the police station or they're staying at a guest house and not going home. So their primary concern also is that, okay, we may get infected because they know that they stand a very realistic chance. And, like since the PPE is not very convenient, they are taking their precautions, but they know that on the field, like they are on the final frontier wherein you're dealing this crowd management. But I think announcements that have been made in the past few weeks have been some solace to them wherein they know that, okay, if something happens, we will be kind of taken care of.
Next, we speak to Deeptiman, who has reported on how the virus has spread in camps of the Central Reserve Police Force and paramilitary forces in the national capital. We started by asking him what role the Central Armed Police Forces or CAPF and the Central Reserve Police Force have played during the pandemic so far.
Central Armed Police Forces have been playing varied roles. One of the most important roles, obviously, is law and order duty along with police and enforcing the lockdown. In several parts of the country, paramilitary forces have been deployed along with the police to enforce lockdown. So there has been consistent contact with people. Sometimes you have to restrain people from going somewhere. Sometimes you have to take custody of people. So you're constantly, coming in close contact with the public, which is how most of the people in the paramilitary forces have got the infection. Second is they've also been because all frontier headquarters of all paramilitary forces, which are across the country, also do a lot of civic action programs, confidence building measures. So, they hold these medical camps, then they will do food distribution for stranded labor or migrant population. So they constantly come in contact with people because they're distributing food, they're distributing medicines, and they're providing some other kind of relief to the people. So paramilitary forces have been at the forefront of both enforcing the lockdown and providing relief to the people.
Deeptiman also explained why more paramilitary personnel were infected in Delhi than in any other state.
India started its campaign of public awareness about COVID slightly late, because of which we are looking at the kind of sternness we show with social distancing and mask wearing and personal hygiene was not there probably in January, February, when cases were spreading at the initial stage. So at that time, if you look at it, Delhi had a high concentration of paramilitary forces because of the visit of US President Donald Trump. And then there were riots. So lots of companies had been brought from various parts of the country to Delhi to maintain law and order, to control riots. So already there was a high concentration of paramilitary forces. Now, any force which comes from outside has to be accommodated in temporary accommodations like schools or some dharmshala. So these kind of places, social distancing is just not possible. Two, there is a regimentation in forces where forces live in barracks. So there'll be a company of 100 odd people who will live at the same place, use common toilets, common kitchen, common canteens, and there'll be halls where people will sleep together. So in this kind of a situation, when even a single person gets an infection, is going to quickly spread through the entire barrack, as was seen in the case of BSF. One of its companies from Jaipur had been brought to Delhi, and it had been put on law and order duties in the Jama Masjid Chandni Mahal area. Now, these have been notified as containment zones of late. And here, almost the entire company, 86 people of 94 who were deployed tested positive for COVID-19. But interestingly, all of them have recovered.
He also points out that the recovery rate has been high due to the age of the personnel and their fitness. But he says that has also posed a problem when it comes to curbing the spread of the virus.
Most of the men have been asymptomatic. They haven't shown any symptoms. And because until now we are going through a phase where we are starting testing only when people show symptoms. So the alertness which is needed around a COVID patient is absent when you have not tested them or when they are asymptomatic. So in a barrack, if there are 5 people who are COVID positive and they are asymptomatic, nobody bothers not mingling with them. So that causes a situation where the virus spreads very, very quickly. So conversely, for the police are also on the law and order duty. But when a policeman finishes his duty, he goes back home. So at the max, if he is COVID positive, he will probably infect 5 of his family members. But when a paramilitary personnel gets infected, he goes and infects about 100 people in the barrack. So that has been the problem, basically because of which things have spread too quickly. Also, because no symptomatic case has come across in most forces. So no testing is being done. For all you know, if you go and test a company deployed in Bombay, you might find 50% of them as COVID positive. But because there is no symptom, nobody is being tested. Because in Delhi, there were symptoms found in various companies. So there was large-scale testing done. So was the case in Tripura. Because there was a symptom. So if one person in a company gets a symptom, then the entire company is tested. So there is aggressive testing when there is a symptom. If there is no symptom, then there is no testing. So you don't exactly know if there are cases in Bombay.
So you mentioned how a lot of them are asymptomatic, and that's perhaps caused also things like the West Bengal government blamed BSF for spreading the virus at one point. Isn't that the risk that these paramilitary forces run then when they're pushed into other places, if are asymptomatic and being transported into areas that are perhaps green zones, they risk potentially taking the virus with them?
It is true. And in fact, more than the West Bengal government, the Tripura government, Biplab Dev, once upon a time, used to tweet every day and used to make it a point to mention that all cases of Tripura are in the forces. All cases of Tripura are in forces. No civilian infection. So he would consistently drive home the point that it is the BSF which has brought this infection to Tripura. And the result of all of this was also that many BSF men started complaining that they were being ostracized in the society. In fact, one BSF group which was transporting one infected person to the hospital who fell sick and started vomiting was chased by villagers because they said that these guys are spreading coronavirus in our locality. So these kind of situations have happened, but there is no exact solution to this problem because you will need forces to maintain law and order, to enforce lockdown. State polices are short-staffed. They do not have as many hands to deal with. There are infections within the state police forces, so a lot of people are incapacitated, like the case in Bombay, which has asked for paramilitary forces. So there is no alternative to deploying paramilitary forces.
Is there also any concern within these forces among the senior officials, because they are perhaps not as young or as fit as these younger recruits? Is that a concern also?
The forces are taking utmost care because most of these senior officers are sitting in their headquarters and sort of are more removed from the streets or daily dealings with a lot of people. So those precautions are being taken in headquarters. In fact, I have seen one senior officer even trying to scratch the back of his ear with a pen after dipping it in a sanitizer. So that is the kind of precaution that a senior officer can take and a constable cannot. So senior officers, everybody is worried. Senior officers have more resources to protect themselves.
And going forward, what will be the biggest challenges for these forces in preventing the spread of the disease?
See, some of the steps have already been taken, which include increasing space in the barracks. See, because you can't rebuild barracks in such a short span of time. You cannot increase the space. So what they have started doing is, because they have a compound and they have some space, so they have started pitching tents so that they can remove some people from the barracks and put them in the tents. And there can be more social distancing maintained. There is greater awareness in the forces, so everybody is maintaining personal hygiene. And there are staggered shifts in canteens so that everybody does not reach and start eating at the same time. So all these things are being done, but of course the forces also have to do their duty, and they cannot be taken off the law and order duties. So largely what the top brass in the forces is banking upon is that these are young men, fully fit, very, very healthy. Most of them are asymptomatic, so nothing is going to happen to any of them. In fact, till now, there have been only 5 fatalities in these 1,200 cases. So that's a good sign. That's a very, very low mortality rate. Let's remember the national mortality rate of COVID-19 is around 2.9. That is 2.8 or 2.9 cases in 100. Now here you're talking about 5 cases in 1,200. So that's very, very low. 90 to 95% of men are asymptomatic. They're showing no symptoms. So these are the positive signs which the force top brass is looking at and saying that we have to discharge our duties. We cannot stop from it. So we have to see that our recovery rates increase further. And they're saying that at the end of it all, you're going to see that we have about 99% recovery.
Prakash Singh is a familiar name when it comes to police reform in the country. The former Director General of Police has been at the forefront of the campaign to reform police forces and is presently the chairman of the Indian Police Foundation. We started by asking him how equipped he thought India's police forces were to enforce this lockdown and handle the pandemic.
The police were essentially not equipped for this kind of situation, and they had no standard operating procedures. There were no instructions on this subject in any of the police manuals or police regulations. So the challenge which came up was dealt with on merits as per the appreciation and perception of the local officers. And I'm happy to say that they rose to the occasion, and they not only enforced the regulatory orders passed by the government, enforcing quarantine rules, enforcing the lockdown, ensuring that whatever restrictions had to be put in place regarding movement from place A to place B, all that was enforced. Regulatory functions were one thing, but they went beyond their call of duty and they projected a humanitarian face of theirs, going out to help people relieve their distress and come to their succor in whatever way they could, providing them medicines, taking them to hospitals. And police, I would say, rose to the occasion in this matter. And the same applies to Central Armed Police Forces. They also had no protocol on this subject, but they all have done extremely well within the area assigned to them.
We asked Singh his reaction to the allegations against police forces and the challenges India's police forces faced in implementing such a lockdown.
You see, the problem in India is, let us first mention whatever instructions were issued by governments, say, in European countries like Sweden or Netherlands or Belgium or UK. Their standard of education is better and they respect any order issued by the government. Once an order has been issued, they try to comply with it to the extent possible. But in India, it is not so. Unless you are strict and unless they know that some kind of action will be taken against them, some kind of force would be applied against them, they would not adhere to the rules of the lockdown. So some strictness was required. However, I'm not denying that at places there may have been excesses committed by the police. But overall, I would say police used the minimum force necessary for enforcing the lockdown and all the restrictions which were necessary along with it.
There's the protest by police personnel in West Bengal that showed their frustration. And there are measures taken by the Mumbai Police to keep spirits up that Mohammed listed, like insurance schemes and special hospitals. We asked Singh about what state governments needed to do at this time to keep police motivated.
The states, there's a lot of things they need to do to keep the morale of the police up. Firstly, they should ensure that police have their necessary protective gear. They have the PPEs, they have masks, they have gloves, they have sanitizers, and it should be available not only to people who are going on duty, but it should be available at every police station. Anybody coming to the police station or to any police unit for that matter, there should be certain facilities available to them. Now, the existing budgets do not provide for purchase of these things. The government should ensure that the necessary facilities which are required as a preventive measure against the spread of COVID-19 infection, those are available at every police station, in fact, at every police building. The kind of insurance cover which government have given to the medical personnel, that if they die, they will get this much money. If they die in the performance of their duties and if they die of COVID-19, they shall be covered by this insurance. Now, a similar cover should have been extended to police personnel also, because they are as much exposed. In fact, there are many places where, but for policemen, the health workers will not be able to go because there's a possibility of their being attacked. So, police are everywhere. And as one national daily said, they are the front line of the front line. Now, in that situation, you should have at least given them the insurance cover also. A third thing, you see, the legal framework that we have today, the legal framework, I think, is very weak and it is very antiquated. It needs to be updated in keeping in view what we have experienced and to give necessary legislative protection and cover to the police.
Deeptiman has pointed to how some states kept pointing at paramilitary personnel when it came to the spread of the virus. We asked Singh about this, and he said it was very unfair.
They would never consciously spread the disease, but they are out on duty. We can very well say that please don't go out on duty, leave the state and leave the country to its fate. We can't say that. They are going out on duty, and in the course of their having gone out on duty, if they come in contact with someone or somebody comes in contact with them for whatever reason, and if the Jawan is infected and he got infected, it's just too bad. It's unfortunate. So, a disciplined force would never spread the infection deliberately, consciously, or maliciously. If it has happened, it is unintentional and just too bad.
So finally, we asked Singh, what are the lessons from this pandemic? And how do police forces plan better for the future?
So far as I know, 4,121 persons of the police and the Central Armed Police Forces have tested positive, and 38 persons have died. 2,866 have been quarantined. Now, this is a pretty big number, and I think it could have been lowered, it could have been reduced, it could have been contained if they had necessary protective gear, which they did not have. You see, gradually medical supplies came, protective gear came, but initially when they were called upon to go on duty and do certain things, they did not have the protective gear. So I think it is essential that these things are stocked and they are available from day one. I think they should build on the experience of this present pandemic. Several states have done things in a manner which has helped the containment of the pandemic. So the best practices at different places that have come to our notice. In fact, the Indian Police Foundation, of which I have happened with the chairman, we are trying to prepare a collection of these best practices. Based on these best practices, I think some standard operating procedures should be evolved, which should be circulated to all the states so that in future, the kind of mistakes which have happened today do not happen. And whatever was successful, whatever was beneficial to the people, going by the experience that we have had, that should be ensured and practiced in future.
You were listening to Three Things by The Indian Express. Today's show, as always, was edited and mixed by our producer Joshua Thomas. If you like the show, then do subscribe to it wherever you get your podcasts. Leave a rating or review. You can also recommend the show to someone you think will like it. It's the best way for people to get to know about us. You can also tweet to us at Express Audio and write to us at podcasts@indianexpress.com.